On cru juste de ne pas aller
your cycle twice a month. Women should learn to count their cycle from the first day that the menses starts, from the first day that is the other one starts. They should know that it is very important anytime that they consult the gynecologist, because he will always try to ask and know what the cycle signifies. I think that is where we ended.
Exactly.
If there are specific questions, then I can respond.
So we'll roll on now with other questions which we were unable to ask due to time constraints. So now, you were talking about the reversible and the irreversible family planning method. Which one of them, which of this method is permanent?
The certainty is we should understand that reversible methods are methods that we can apply, and the time that you want to stop, you can come back to us, or you can voluntarily, independently, individually stop the method and come back to your normal cycle. Irreversible methods are methods that immediately we implement, we cannot turn back the hand of the clock. It means if we implement that one, we cannot stop. And those methods are tubal ligations, what we women generally call tying their tubes, or for men is what we call vasectomy, sectioning, cutting off and tying the cord, the canal that carries spermatozoa from the man to the woman. So we can block that and also block the tube of the woman, such that ovules cannot, or spermatozoa cannot reach and fertilize the ovules. So those two for man and women are irreversible methods. All the other ones that we talked last week with respect to natural methods and the other artificial methods like implants, like intrauterine devices, and like condoms or protective methods, all those ones are reversible methods. Okay. So those are the different ones that we have, the reversible and irreversible.
Okay. And according to the World Health Organization, over 200,000 family planning services are needed in sub-Saharan Africa. Tell us, how ready are the services in Cameroon?
I thank you for that question. I want to say that the ministry has done a lot to try to implant a family planning service in practically all hospitals, especially from level 1 to level 4 hospitals. That is referral hospitals, central hospitals, regional hospitals, and district hospitals. All of those hospitals have a service of family planning. Now you have subdivisional hospitals. Some also have services of family planning. You just need to approach any of these hospitals and you go to a service that you have trained personnel on family planning. I think women should access family planning whether they want to, they have problems of conceiving or they want not to conceive. They should first of all access family planning services. Only in family planning services that they can see whether your problem needs the gynecologist to consult you or not. Because women just have problems of conceiving and they go and see a gynecologist. It might just be because you don't know how to follow your cycle. So when you consult at the family planning service and they see the need for you to see a gynecologist, then you go and meet the gynecologist to solve your problem for conception or to prevent conception.
Okay, so now talking about the different methods you just mentioned, how effective are the different methods and how long does it take for it to, let's say, expire? Talking about those which are reversible.
Yes, good question. Reversible methods, we have given the different groups. There are hormonal methods, and there are barrier methods, and you have mechanical methods. The hormonal methods, we call them, either they are pills that you take every day at the same time. Every day at the same time. So if you decide to take it at 8 o'clock in the morning, you have to take it 8 o'clock in the morning every day. Insofar as you start giving intervals, you take it 8 this time, you take it 9 the other day, and so on, you start having problems of being effective. But if you take it constantly at the same time, the effectiveness is about 99%. You are sure that at 99% you will hardly be conceived. The next method is implants. Implants is either Jadere or Implanon. 1 stick or 2 sticks. Before we used to have Norplant. Norplant was 6 sticks. Now we don't have Norplants again. We have evolved from Norplan to Geber and Implanon. Those ones are 3 years and 5 years. So you can go on that one, and it depends on the one that you take. Its efficacy is from 3 years and 5 years, and it can go on to about 99.9% of efficacy. You have the barrier methods that are the ones that everybody uses regularly are condoms. Condoms are barrier methods. That's the one that you have to use at every intercourse. Even if it's 10 times a day that you have an intercourse, you have to use the barrier method and use it effectively. If you do it effectively, certainly the efficacy rate will drop to less than 50%. And then you have mechanical method, that is the implant, is the IU, the intrauterine device, the one that will insert into your womb. That one stays from 10 years to 12 years. But of course, all these ones that have this duration, we can remove them at any time that you want us to remove, or at any time that you develop an adverse effect that we think that doesn't permit you to keep again the method. Okay. So it's not because we insert a method today, it has to be there for 10 years. Anytime that you want us to remove, we remove. Anytime that you have an adverse effect that we think that we have to remove to solve that effect, we take it out.
So now, are there any health complications that can determine what family planning method will be good for a particular person or some other person?
Perfect. This is a very interesting question. And these are the type of questions that I advise those who are giving family planning methods to always check. Every person is tailored to take a particular family planning method. You cannot transpose a family planning method from a sister to another sister. It's not because they are sisters. It's not because it was good for one person, it means it's good for the other person. It's not because somebody left the house and come that I want to take this particular family planning method. When the provider will just give that family planning method. You need to assess to be certain that this person who is in front of you is eligible to take that particular family planning method. Each person is classified with respect to a family planning method, whether the person can take that method or cannot take that method. Of course, there are pathologies. There are many different pathologies that can prohibit you to take a particular family planning method. And it's only the provider who can assess you and see that you are not eligible or you are eligible to take a particular family planning method. That is when they will explain the family planning methods to you with their inconveniences. Certainly, they are I would say there's practically nothing that we do in life, even natural things, that does not have inconvenience. It might have an inconvenience, but the advantages outweigh the inconveniences. That is why we give you the method.
Okay.
So we just need to assess you properly and give you the method that is tailored to you. It's not us choosing the method for you. You choose the method by knowing the advantages and the inconveniences of that particular method. That's what we talk of informed consent. You must know exactly what are the advantages and inconveniences to a method, and you voluntarily choose that method. That's the only way you can keep the method as long as possible, because our objective is not to give you a method. It's to give you a method and permit you to keep that method for as long as possible. It doesn't make any sense to take a method today and 2 months, 3 months after you come back that I don't need the method. So we don't give a method because we just want to give. We'll give a method that you can keep the method as long as possible. And you can only do that if you understand the advantages and inconveniences of a method.
Okay, our technician Rafael Dipanda will display the following numbers so you can call and participate and equally ask some questions concerning family planning. So before he does that, so I can read it out, I will get back to you, Dr. Philbert Echo. So now, there are a lot of women who are so scared about, okay, just display the numbers. Here they are, 655-511111 or 652-025050. You were talking about the different family planning methods, especially that of artificial. I guess lots of women are really damn scared of going into such methods because of the risk, even though you said there's nothing that doesn't have a risk, even if it's natural. But lots of women have had some very bad experience when it comes to family planning. Do you think it's due to the person who did that family planning procedure, or maybe it's out of negligence from the person who carried out the family planning?
Sincerely, I do appreciate that question.
We have a call on the line. We'll get back to you, doctor. Hello?
Hello.
Yes, madam.
Bonjour. Can I
Bonjour.
speak in French, please?
We'll
Sure.
try. Okay, sure.
Sure.
We just lost that caller. Okay, back to you, doctor.
Yes, I was just saying that this is a very interesting question, and these are the things that we want to erase from those who are the users of family planning services and even the providers, because family planning has barriers. And the first barriers are us, the providers, the personnel. I think we are trying to enlighten them to understand, first of all, what are family planning methods, and to know how to counsel women. First of all, to screen those who can take particular methods, and to counsel them properly. Because if you don't counsel, most people just go to family planning services and they are offered methods without thorough examination. And those are the things that can permit you develop complications. Certainly you can develop an inconvenience. An inconvenience is something that we know it might happen. The things that we know it might not happen and happens, of course, those are undesirable effects, and those are the things that we look at to try to remedy.
So what are some of those effects? Can you basically name some of them so some people can be aware?
The inconveniences in practically all the methods are bleeding problems.
Okay.
In the sense that you might have a problem with your cycle. You might either have spotted bleedings in between your cycle. You might either have a little bit heavier cycle. You might either have an absence of your cycle. These are the things that you might have, depending on the person.
There are some women who complain that they gain lots of weight during that. We have a caller. I'll get back to that question. We just lost that caller. Okay. There are some women who complain of the fact that they gain weight while carrying out the family planning procedure, while others complain of, let's say, cancer. I don't know if it's a myth or it's a reality.
Thank you again for this question. I don't know how much time we have, but it's interesting family planning. I want to say, with respect to weight gain, I used to ask women simple questions. When they were singles and they enter into marriage and they start gaining weight, is it because they took family planning? No. When they live sedentary lives and they start gaining weight, is it because they took family planning? No. If you take a family planning method and you maintain a sedentary life, it is certain that you gain weight. Studies have shown that the quantity of weight gain per family planning method, directly linked to family planning method, is practically 1 kilo per year. One. So you understand that if you gain 20, 30 kilos or 10 kilos in months or years,
we have a call.
It has nothing particular to do with family planning method. It's your life. Take your life, adjust your life, continue to go away from sedentary life. And of course, there are people who even lose weight taking family planning methods. There are people who lose weight. That is so for weight, it is not trouble. You just need to arrange your life to go out of sedentary life and know how you eat. You don't just eat anyhow because you're on family planning method. And again, when you take a family planning method, you have peace of mind. And when you have peace of mind that you cannot conceive tendency, is psychologically, you continue and you live a happy life and you continue to gain weight. That is another thing. You talk of cancer. Those are what we call rumors or false information.
Okay.
Yes, family planning method. There is no family planning method that causes cancer. But family planning methods like hormonal methods can stimulate the rapid progress of cancer. What does that mean? It means any woman who wants to come and take a hormonal method of family planning must be thoroughly screened for cancer, especially cancer of the breast, cancer of the ovaries. You must be thoroughly screened. They must check even your family.
We have a call on the line. I hope it's going to be better. Hello?
Hello?
Yes, madam. Hello?
Oui, allô, bonjour.
Bonjour, madame. Vous pouvez demander votre question.
Pardon?
Vous pouvez demander
Oui.
votre question.
Oui.
On vous suit, madame. Demandez votre question.
Ok, en fait, je suis Sonia.
Oui.
Je viens de faire 2 césariennes. Enfin, j'ai eu 2 césariennes.
D'accord.
J'ai eu 2 césariennes et je voudrais savoir quelle est la méthode la plus adaptée pour moi pour ne plus retomber enceinte.
D'accord, madame. On va vous répondre dans quelques secondes.
Merci.
Hello, Dr. Philbert.
Yes, madam.
Did you get her question?
Yes, I did get her question.
Okay.
If I could, I think she said
she had two C-section and exactly.
And she wants to know which method
will be
is
convenient
for her.
Exactly. The more reason why you said they have to see, let's say, a gynecologist to know which will be convenient and not just listen to what we'll say here, because it's from there that she will be able to know which is convenient, right?
Sure. As I've just said, the first thing is she needs to be. There are many questions. They need to evaluate her antecedents, medical antecedents, to know whether she carries a pathology that might not permit her to take hormones. If she has no pathology that might not permit her to take hormones, she might go on hormones, because if your uterus is carrying a scar, to put an IUD is a risk. Normally, the IUD, if we had to put, we would have put an IUD by the time that she was carrying out the cesarean section. Okay. Immediately after the cesarean section, they put an IUD. That's an intrauterine device. But after the cesarean section, they can put, but it is risky. She must go to somebody who is more competent. What I just simply mean is she should consult the family planning service, and they will evaluate her correctly, and they will know the method that is adapted to her with respect to her antecedents.
Okay. Thank you. So we'll go back to what we're talking about, cancer, and how it's related with family planning. And we're talking about hormones. Yes,
because breast cancer and maybe ovarian cancers and endometrial cancers are what we call hormone-dependent cancers. It means they are stimulated by hormones in such a way that if you are taking hormones, estrogen and progesterone, or only progesterone, it might stimulate cancer cells that are already found in you. So you need to be evaluated properly from your antecedents, family antecedents, to see that you don't run a high risk of developing cancer. If all those things are taken care of and you are given the method, then there is lesser risk that you develop a cancer. It's not the family planning that causes the cancer, but the family planning can bring to limelight.
We have another call on the line. I hope we'll have time to... Okay, we just lost that caller. Before we end this program, doctor, there's one pertinent question I want to ask you. We have lots of youths who now depend on morning pills. That means after carrying out sex, they take those pills. Are there any very dangerous side effects related to morning pills?
Yes, I want to answer that one very fast before time cut off, because it's very important.
Exactly.
I think when I listed all the methods, I didn't list emergency contraceptive as a method.
Exactly, you didn't.
This is what we call morning after pills. It is an emergency contraception. It has nothing to do with planned contraception. What does that mean? It means when there is an accident, and an accident is not something that you plan. An accident is something that happens without your knowledge. The only accident that we consider in medicine is either you're raped or you use a barrier method and it got ruptured. You don't just go and plan. What does that mean? Emergency contraception is highly dosed. It's just like injectables. Injectables, the risk or the effect of injectables, that is the what you go and inject every 3 months, is something that can block your cycle for more than 6 months. It's something that delays your fertility comeback to even 1 year and above. If you start taking after morning pills, emergency contraception regularly, you run a high risk of going to hypofertility or infertility, because it will disturb your cycle completely. And that is what many women go through now, many young girls. They just take morning after pills as regularly as possible. And by the time they start looking for children, they start having problems, because it has distorted their cycle completely, and then we cannot readjust it. And if we don't understand it, some of us who have not done family planning will start turning around with hormones to stimulate you or not to stimulate you, and worsening the situation. So women and girls should be very careful as they are taking morning after pills or emergency contraception. It is not something that you plan to go and take. If you don't want to be pregnant, go to a family planning service. Let them give you a proper family planning that is adapted to you, and not morning after pills, because it's not an emergency.
Thank you so much. That was Dr. Philbert Eko, obstetrician, gynecologist, and reproductive health consultant. He was our guest for today, and that's it for this program, UNA Health Ed on Equinoxe Radio Multimedia. For presentation, I am Immaculate Fogwe, and I received technical assistance from Raphael Dipanda. Thank you so much for your keen attention. Stay blessed in the company